Hey guys, let's talk a little bit about skin sensitivity and the tape. Obviously getting quite a few questions about how the tape may or may not react with the skin. For clients who have diabetes, that is definitely a contraindication. You will need to assess that on an individual basis. There's absolutely no doubt about it, primarily because of the vascular challenges of the skin. So with your diabetic patients, if you're going to apply the kineso tape, I would trial it first. Touch wood, for myself, I've not had any clients that have reacted to the tape at all. This also brings me to the topic which also a lot of you are asking about is what type of tape and how much do I buy? So the investment for you is obviously, and I always ask myself this, is if you're after a quality product, you're obviously going to pay a quality price. For me, I use rock tape. I've used numerous different types of kineso tape over the years. This is the one, for me, that has never let me down. It's a premium quality tape in the fact that it adheres beautifully to the skin and it has great adhesive qualities. So it means you can wear this up to 3, 5, even possibly 7 days, which is a massive bonus, especially with your athletes. It comes obviously in different sizes and packages. This here is the 10 centimetre, but it also comes in a 32 metre roll. This is what I use in clinic. So it's imperative that you also keep in mind that if you're going to be doing a lot of taping in clinic, then maybe the bigger rolls are going to be more affordable. You can get this in a 5 metre as well, so they're easy to carry around and use. If you're not using the 32 metre, then I would have suggested going to the 5 metre rolls. If we look at the 5 centimetre, obviously comes in packages such as this. 5 centimetre, this is a 5 metre roll. So once again, it's about if you're going to use the tape in your clinics, then there's a fair chance that a big part of the tape that you're going to be using can also be retail as well. So if you've got these, then with a lot of my athletes, the 5 metre rolls, I actually get my athletes to purchase them off me, and then the idea is that they just bring the tape in whenever they need to be taped. You can get the 5 centimetre roll also in a 32 metre roll as well. It's a practitioner's length, so you keep that in your clinic. So obviously they vary in price, but you'll find that it's a lot more affordable. Whether or not you want to factor that into your treatment costs, that's something that I do. So there's a small little surcharge for the use of tape, unless my athletes or my clients actually come in and purchase their own tape and then they use it as we need it. So that's probably the most popular choice. If they're one-offs, then obviously you may want to look at just charging them a small surcharge. So so in terms of looking at what types of tape, obviously I'm recommending rock tape, but by all means there's plenty of other quality tapes out there on the market. This is just the one that I use, it's the one that I've trialled, and obviously this is one I get the best feedback for. Also, let's just quickly talk about taking the tape off. One thing that you shouldn't do is basically rip and pull it off quickly. Now, obviously with rigid tape, that's what happens a lot with a lot of people. I'm not a big fan of it myself, but I mean, there are obviously going to be individuals who are just happy to rip it off. I would be more inclined to just slowly peel it off bit by bit. If you're having trouble getting it off, sometimes my clients take it off in the shower, so you can get a wet towel or a damp cloth if you like, and just dampen it, and then it makes it easy to come off. You can also put some massage oil on there as well, and that also makes it easy to get off. I hope this little video gives you an overview of some of the questions that you've been asking us about the tape. Look, it's a fantastic taping technique. If you've got clients coming in with shoulder problems, or whether it be calf, thigh, hip, whatever the case may be, locate the most troublesome trigger point, and that's the area that I would place it on. Coming up, I'm sure we're going to do some more taping techniques for you. We're going to look at taping actual conditions, some pathologies, which will also be great, and that will expand your knowledge also.